In this ASCO GI meeting, I summarize the current landscape of cellular therapy for GI cancers. Still, this is not the standard of care, but many trials have been conducted to test cellular therapy for GI cancers. Most common type is CAR-T, which is engineered to express receptor and recognize the tumor antigen as a shared antigen and induce cytotoxicity because of the powerful enzyme and cytokine release. This treatment requires various process and not so easy treatment. Actually, several trials have been conducted. One of the major breakthrough is Claudin18.2-targeted CAR-T, which shows a promising activity in Claudin-positive gastric and GI cancer. And very recently, it was press released that this Claudin-targeted CAR-T showed an improvement of PFS compared with third-line chemotherapy in Chinese randomized phase 2 study. I believe this must be the first randomized study to show the benefit of CAR-T in solid tumors. But still, there is many aspects to consider this to be used in clinical practice. For example, multiple complicated manufacturing process, conditioning treatment, and cost. So we need to, improve such aspect before using it for all patients. I believe more clinical trial and more solution must be needed. And one of the interesting strategy is to use in vivo CAR-T, which give CAR genes by viral vector or nanocarrier to achieve CAR generation in situ. So this may omit complicated manufacturing process, and there seems to be some concern about safety or actual delivery, but already clinical trial is ongoing, so let's stay tuned, and hopefully it may expand the targeted population to be treated by CAR-T in the near future. And other treatment as a cellular therapy could be cellular therapy with innate immune cell, which is better in terms of activation of other immune cells and easier off-the-shelf production. And several trials are ongoing, and one of the trials are our iPS-derived off-the-shelf NK cell therapy, and the trial is ongoing in an institution. And iNK T cell therapy is also tested as a combination with chemotherapy in gastric cancer space. And other types of cellular therapy include T therapy and TCR-T therapy. And these treatments have been approved for other types of tumor, like a melanoma patient or a sarcoma patient with MAGE-A4 expression. And this kind of cellular therapy have been also tested for GI cancer. So in the near future, I believe it could be treatment option for patients. So all those many trials are required, but this kind of cellular therapy and its future is bright for me.